And welcome back to Body Beautiful. I'm Janelle Marie. We are here with Dr. Joseph Mealy, plastic surgeon, and we love when you are here.
I'm happy to be here.
Talking about all kinds of things. We had breast augmentation revision. Now we are going to talk about liposuction.
Sounds good.
A lot of people talk about liposuction. It's very popular.
It's one of the most common procedures.
Most common procedures.
Yeah.
So what is it for those of us who might not know?
So really it's a way to remove fat through a small incision.
Okay,
So
very simple.
Yeah, we put a cannula in there. It's like a hollow straw and lets us suck out the fat.
Who's the best candidate for lipo?
People who are stable in weight, who have disproportionate areas of fat that are well localized, and those areas bother them, of course.
So not largely overweight people, probably not
Correct.
a good thing.
Correct.
Okay.
Yeah, there's the maximum we remove at a time is 5 liters, which is about 11 pounds. So
Gotcha.
if someone's really overweight, it's not a
So
good way to
it's
lose weight.
Those stubborn areas that won't go
Yes.
away. Let's go to picture number 1. This is a
so
man,
most of my patients,
right?
like this guy, is in good shape. He really doesn't have a lot of extra fat, but for whatever reason, his body wants to put it on his chest.
Gotcha.
And it's full. And when he's wearing a shirt, it sticks out and it makes him uncomfortable. So what I've done is liposuction, made a very small incision in the axilla, in the armpit, and was
That's
able to
great.
vacuum out that fat.
Can't even see the scar.
No, the nice thing about putting it there is it's hidden, even if it's a bad scar.
Yeah.
But usually it's a good scar and hard to see.
A lot of men come in for liposuction like this?
Yes, and gynecomastia reduction too. In this case, there was very little gland, so liposuction alone was perfect.
So the men will probably come in if it starts to hurt, if they're wearing shirts or it starts to rub.
Sometimes,
and maybe,
yeah, the nipple will get rubbed raw,
Gotcha.
but often it's just the inability to wear a tight shirt or a solid color shirt.
Picture number 2.
So similar. So again, a little bit of liposuction on
Yep,
the chest,
that's
as well
great
as
result.
the abdomen.
Very
So-
natural, can't really see the scar. And what's his downtime on that?
So downtime, it's a few days.
Okay.
Most people by the end of the week are feeling fine. I would make it sort of akin to working out. So if
Okay.
you do a heavy workout, get that muscle ache for a few days and it gets better.
That looks great.
That's kind of what it's like. So
All
if it hurts a lot, something might be wrong, and I expect my patients to call me if they're
Yeah.
having a lot of pain. But,
Before picture number 3, though, I've got an email. Louise from Alamo wants to know, if you do suck fat out liposuction,
Yes.
will it grow back in other areas? That's a good question, because I hear that from a lot of people. Is it going to grow back somewhere else, like my elbows or my whatever?
well, it'll go wherever your body wants to put it.
Ooh.
So for people who have a stable weight, usually that's not an issue.
Okay.
But if you gain weight after liposuction, it's going to go somewhere.
Oh.
Sometimes it'll go back to the same place. Sometimes it'll only go to a different place. But usually it comes back more uniformly. So even then, it tends to look a little bit better. But the best goal is to keep the weight stable.
And that's why you probably want to just get those areas that you need it in, not large areas. Okay.
No, it just gives me the opportunity to really focus in on where the
Gotcha.
problem is and make it match the rest of the body.
Exactly. Next picture?
So this is a woman with some fat above and below the belly button, hasn't had children, so we really don't want to
Okay.
do a tummy tuck at this stage.
Okay.
And usually when we're younger, our skin recoils better anyway.
Yes.
So I can suck that fat out and I don't have to worry about it falling over or wrinkling. It just looks nice
Where are
and
the
smooth.
scars in that one?
Usually in the groin.
Oh, really?
Below, sometimes I'll sneak one
Really
in the belly
good.
button. But they tend to hide well. The incisions are a quarter inch, 3/8 of an inch.
And do you put people out with general anesthesia for that?
I normally do.
Yeah,
If it's
okay.
a small area where we're doing a touch-up, something like that, we can do that under local. But if we're doing bigger areas, it's just easier to get it done right.
Yeah.
I don't have to worry that I'm going to bother somebody in the procedure.
Absolutely.
And I like to be able to beat them up as much as I need to get a good result. So.
Yeah, because what are types of liposuction? It's small cannulas, big cannulas. I mean, what do you
Yeah,
do?
these days we tend to use smaller cannulas.
Okay.
We use a tumescent technique, which means we put some fluid in beforehand. That increases our
good.
target. It decreases bleeding and bruising, and also I think helps with comfort afterwards. There's a little bit of local anesthesia in there.
So now the bruising isn't so bad because it used.
Bruising is better. Sometimes
Bruising
we
is-
still get a good
yeah.
bruise, but most of the time it's pretty good.
Next picture.
So same idea. The incisions are placed low in the groin. I think I did put one in the belly button this time to get the upper abdomen.
Looks really good.
And we're always trying to kind of clean out that center area, see if we can make a little indentation there.
Right.
That linea alba looks really nice.
Beautiful. Very natural.
Well, it's teamwork. She was in pretty good shape.
Oh, well, that's true.
So I have something good to work with. I can get a good result.
And our final picture here. This is popular, right? People
Chin,
coming in.
very popular. It's a very easy, quick procedure. This is something that can be done under local if that's all we're doing, but often we're doing it in combination with other procedures.
Where are you putting the scar there?
Normally in the fold right underneath the chin,
Really?
where about half my patients have fallen down as a kid and already have a little scar.
Yeah,
So-
that's true. You fall
makes
into
it
the
easy.
coffee table.
Yes. Yeah.
We've all had that.
So
And
in this case, again, you have to have good skin tone. And,
Okay.
and in her case, she's got a nice angle between the jaw and the neck. That's something I can't create. It's set by the hyoid bone. It sets
Wow.
where the muscles go. If I can suction out the fat and that's in the right place, it looks great.
And can people do all the liposuction procedures together? Let's say they need it on their arms, let's say they needed some on their thighs, and maybe, you know, under the chin. Can you do it all at once?
It's very common that we do multiple areas.
Oh, really?
Of course, they have to be healthy. You have to be screened. Got to see a board-certified doctor who knows what they're doing.
Yeah.
If I'm doing a lot of stuff, not so much with liposuction, but a lot of multiple procedures, often I will keep a patient overnight just for their safety and also for their comfort.
All right.
But for lipo, usually you can go home the same day, a little sore, not bad.
Not too big of a deal.
I do have you wear a garment, though. A garment also
those
gives
tight
some
garments,
compression.
yes.
Just tight enough, but not too tight.
Those feel pretty
It helps to
good.
keep the skins flat and smooth.
All right, well, there you go for liposuction. For more information about Dr. Mealy, just call 925-943-6353. Check him out on the web at either drmealy.com or sanfranciscobreast.com. All these before and after pictures are actually on the website, so you can go there and check them all out. We'll be right back on Body Beautiful.